Hello, everyone. My name is Faeben Wossenseged, and I'm a postbac within the Bottom Lab. And today I will be talking about my project, Avatar Study, Use of Race in Clinical Decision Making. In recent years, advances in genomic and precision medicine have emerged, providing a more personalized approach to treatment and care, and offering a solution to a long-standing controversy within the healthcare field: the use of race within clinical decision making. Within medicine, race is often used as a proxy for ancestry and disease risk, even though it is a social construct rather than a biological phenomenon. This issue can be traced back to medical and nursing education. Medical students are often taught about race without context in relation to racism, leading to race-based diagnostic bias and guidelines. Within nursing education, cultural competency is emphasized, providing standardized guidelines to how nurses care for a diverse set of patients. Literature has shown that strict adherence to these guidelines may possibly increase nurse practitioner use of race in comparison to physicians. To truly assess how genomic and precision medicine may alleviate the controversial use of race, we must first understand how race is currently being utilized in clinical practice. Our project looks at clinical decision-making regarding pharmacogenomic testing, genetic testing on patients' responses to certain medications. A cohort of nurse practitioner students and a cohort of medical residents were made to interact with one of four types of avatars: white or Black, and high socioeconomic status or low socioeconomic status. Their use of race was measured using the Racial Attribution in Clinical Evaluation, or RACE, scale. This scale asks participants questions on topics such as whether they consider a patient's race when determining genetic risk for diseases or when deciding what medication to prescribe. Participants' genetic knowledge and implicit bias were also measured using the GKAI scale and the implicit association test, respectively. In my specific role for this study, we are looking to compare the average race scores between the two cohorts to better understand how differences in medical and nursing education affect how the two professions utilize race. Based on literature, we hypothesize that nurse practitioner students will have higher race scores, indicating more use of race in clinical settings. Overall, we hope to use our findings as a starting point to develop interventions within the education of these students about race usage in clinical decision-making in the hopes of improving care for all patients. Thank you.